A new bill tabled in the Alberta legislature on Thursday would change how laws are made during the next health crisis. This after a number of COVID-19 related charges had to be dropped because the decisions were made by cabinet and not the top doctor.
The Ingram decision showed that Alberta needs to clarify the roles and responsibilities of cabinet and medical officers of health, including the chief medical officer of health, so that we can be in line with our own legislation.
Back in June, the Ingram court decision found Alberta's public health orders during the pandemic response were invalid because cabinet, not medical officials, had the final say. If passed, this legislation will see elected officials gain control over decision-making in public health emergencies like the stay-at-home and gathering limits in recent years. Health law expert Lorian Hardcastle says the bill provides transparency around future public health orders.
It was important that this be opened up, and I think provinces across the country need to look at their public health acts and evaluate how they operated during COVID and whether they're prepared from a legislative perspective to go into the next emergency.
The amendment also includes a paramountcy clause, giving elected officials power to undo or change any decision under the Public Health Act outside of an emergency, like boil water advisories and health-related closure orders. Alberta NDP health critic David Shepherd expressing concern with the move, saying future critical public health decisions could be affected by political interests.
We are facing a government now with the Premier who has on many occasions expressed extremely anti-science views. It is concerning to us that this could lead then simply to further politicization in the place of medical science and expertise at a time that could have severe effect on Albertans' health and indeed their lives.
Alberta's Justice Minister says the new legislation would provide clarity and accountability on who's responsible for any public health orders, wanting to make it clear health restrictions are in the hands of those we elect with advice from the Chief Medical Officer of Health. In Edmonton, Elliot Knopp, City News.